Hello everyone. Good evening to all. Okay, just wait for 1 minute. Hello everyone. Welcome to a discussion of most important topic in biochemistry, that is lysosomal storage disorders. Okay, in lysosomal storage disorders, there are few important points to remember for your entrance examination. All of you know that Gaucher's disease is the frequently asked question in your NEET PG exam or any entrance exam. Gaucher's disease is an important topic, very important topic. If there is a case of liver, bone and spleen involvement with some classical features, that is known as crumpled tissue paper appearance or wrinkled paper appearance, go with the Gaucher's disease. It is a most common lysosomal storage disorders. All of you know that lysosomes, they contain the group of enzymes, they are known as hydrolases. What is the name of enzyme? Hydrolases. It is a bag of enzyme. Lysosomes, they contain hydrolases, and if there is defect or mutation in the hydrolases, that causes accumulation of lipids, in the macrophages. Okay, so lipid laden macrophages or accumulation of certain lipid substances that causes the features or clinical manifestations in the disease. Okay, just wait. That causes clinical manifestation of disease or clinical manifestations. The most common is the Gaucher's disease. Just see this. This is a simple one-liner question. Enzyme deficient in Gaucher's disease. Which enzyme is deficient in Gaucher's disease? Yes, it is beta glucocerebrosidase. Okay, beta glucocerebrosidase. See, just keep some things in the mind. Ceramide. What is ceramide? It is fatty acid plus sphingosine. Sphingosine is an amino alcohol. Okay, so ceramide is fatty acid plus sphingosine. Okay, when you add glucose to it, it becomes glucosyl ceramide. It becomes glucosyl ceramide. See, plus glucose, it is glucosyl ceramide. Another name is glucocerebroside. Another name is glucocerebroside. This is another name. And the enzyme which causes degradation of this glucocerebroside, they are known as glucocerebrosidase. What is the name of enzyme? Glucocerebrosidase. See, ceramide plus glucose, it is glucosyl ceramide or glucocerebroside. An enzyme which act on the glucocerebroside, it is known as glucocerebrosidase. The beta glucocerebrosidase or beta glucosyl means glucosyl ceramide, which act on glucosyl ceramide, it is known as beta glucosidase or glucocerebrosidase. Okay. Now, if it is ceramide plus galactose, it is known as galactosyl ceramide or galactocerebroside. Got it? When it is oligosaccharide unit, if ceramide plus oligosaccharide, it is known as globoside. It is known as globoside. And if it contain NANA, that is N-acetylnuraminic acid, means N-acetylnuraminic acid, then it is known as ganglioside. Ganglioside, GM1, GM2, GM3, depending on the chromatographic separation, they are classified as ganglioside monosilo. GM means ganglioside monosilo, GM1, 2 and 3. Okay, and depending upon the accumulation of GM1, GM2 or GM3, the name is given to the disorder gangliosidosis. Okay, GM2 gangliosidosis, which is common, that is Tay-Sachs disease, Sandoff disease, Tay-Sachs Sandoff disease. Got it? So these are the some things to keep in the mind when you read about the lysosomal storage disorder. But don't forget to read. If anyone is there, just click the thumb or give any comment so that it will be interactive. Okay, I am visible, audible to all of you. Yes. Okay, thank you. So these things should be kept in the mind while reading the lysosomal storage disorder. Once again, I will repeat. See, what is ceramide? Ceramide means fatty acid plus alcohol, that is sphingosine, means fatty acid plus sphingosine. This is the most important MCQ for the UG. Okay, first MBBS students. Ceramide. What is ceramide? Fatty acid plus sphingosine. If you add glucose, it is glucosyl ceramide or glucocerebroside. If you add galactose to it, it is galactosyl ceramide or galactocerebroside. Okay. If you add oligosaccharide, it becomes globoside. And if you add NANA to it, N-acetylnuraminic acid or sialic acid residue, it becomes ganglioside. And depending upon the chromatographic separation, it is GM1, GM2 and GM3. Okay, and depending upon the accumulation of particular lipid, the lysosomal storage disorders are named. Okay, for example, GM1 gangliosidosis, GM2 gangliosidosis. Okay, like this. Got it? So once again, now this is most important question for NEET PG entrance examination. Okay, अगर आप एंट्रेंस के लिए प्रिपेयर कर रहे हो और आपने ये क्वेश्चन या गाउशर्स डिसीज आपने नहीं पढ़ा है, तो आप अभी भी आपके पास टाइम है. जस्ट कीप all the things related with the lysosomal storage disorder in your mind, and Gaucher is the most important question. Gaucher is a bro. Gaucher is a bro cerebrosidase. Okay, Gaucher's disease, it is due to defect in the enzyme glucocerebrosidase. Okay, now see the question. A patient presented with refractory anemia. A histological picture is shown with cells in bone marrow. Which of the following enzyme is deficient? See this image. ऐसी 3-4 इमेज रहती है या सिंगल इमेज भी रह सकती है. दिस इमेज टिपिकली क्रम्पल्ड टिश्यू पेपर अपीयरेंस और रिंकल्ड पेपर अपीयरेंस of the lysosomes that indicates the Gaucher's disease. Now, which enzyme is deficient in the Gaucher's disease? So here answer is, just wait, answer is Beta glucosidase. Another name is glucocerebrosidase. This is answer. Glucocerebrosidase. There are number of typical features in the Gaucher's disease. See, just 3 to 4 disorders, they are very, very important. One is the Gaucher's, second one is the Tay-Sachs disease, and third one is the Niemann-Pick disease. These three are very, very important. इसमें भी कुछ important points है, वही याद रखने हैं. सभी point तो कोई भी याद नहीं रख सकता. It is very difficult to remember. It requires lot of revision. Okay. दो चार पॉइंट है जो याद रखना है. पहला पॉइंट, चेरी रेड स्पॉट किस में रहता है? चेरी रेड स्पॉट मैक्यूला में कौन कौन से डिसीज में नहीं रहता, कौन कौन से डिसीजेस में नहीं रहता, ये पॉइंट आपको याद रखने हैं. ओके. देन दूसरा, गाउशर्स डिसीज के टिपिकल फीचर्स है वो याद रखने हैं आपको. जैसे एर्लेनमेयर फ्लास्क डिफॉर्मिटी इज देयर, रिंकल टिश्यू पेपर अपीयरेंस इज देयर, दैट द गाउशर्स सेल, इट इज इंट्रासाइटोप्लाज्मिक इंक्लूजन बॉडीज. Okay, lipid laden macrophages or intracytoplasmic inclusion bodies are there in the Gaucher's disease. There are three types of Gaucher's disease: type 1, type 2 and type 3. And in type 1 there is no involvement of central nervous system, while 2 and 3 there is involvement of central nervous system. So in Gaucher's 1 there is no involvement of the brain. There is no cherry red spot in the KGF. Okay. Krabbe's disease, Gaucher's disease and Fabry's disease. All these disorders, all these lysosomal storage disorders, they are autosomal recessive except Fabry's disease. Remember this point. All are autosomal recessive except Fabry's disease. So see, Gaucher's disease, it is due to the defective enzyme. The name of the enzyme is Gaucher is a bro. Okay. So it is glucocerebrosidase. Glucocerebrosidase. Okay. There is defect in the glucocerebrosidase GBA gene which causes defect in the glucocerebrosidase, due to which glucocerebrosides, the degradation of glucocerebroside does not occur. And the glucocerebrosides, these are the principal component, these glycolipids, these are principal component of plasma membrane, and accumulation of glucocerebrosides causes lot of manifestations, and it particularly involves the liver, it involves spleen, and it involves bone marrow. Liver, spleen and bone marrow, it is involved in the Gaucher's disease. Okay, liver, spleen and bone marrow. So there is hepatosplenomegaly. Hepatosplenomegaly in Gaucher's disease. So organomegaly is there. Okay, organomegaly is there. There is involvement of bone marrow. There is involvement of bone, and bone deformity will be there. The main is avascular necrosis. Avascular necrosis of long bone, and it gives characteristic feature in the X-ray. In the X-ray, in the Gaucher's disease, it gives characteristic feature. So in X-ray, suppose this is femur. So there is one deformity that is known as Erlenmeyer-Flask deformity. That is known as Erlenmeyer-Flask deformity. Erlenmeyer-Flask ऐसा रहता है. ओके, बायोकेमिस्ट्री में देखा है ना, फ्लास्क, कोनिकल फ्लास्क. Erlenmeyer-Flask deformity in X-ray, it is a feature of Gaucher's disease. There is involvement of liver, spleen, bone marrow that causes anemia. Okay, so it causes anemia. It causes pancytopenia. It decreases all. It causes anemia. It causes thrombocytopenia. This is mainly because of sequestration of platelet by the enlarged spleen. Thrombocytopenia is there, and that causes bleeding tendencies or easy bruising. That causes bleeding tendency, bleeding or bruising. That causes bleeding or bruising. Apart from these features, there is due to accumulation of glucocerebroside continuously, the macrophages are loaded with the lipid, or they are laden with the lipids, and that is that gives typical picture that is known as crumpled tissue paper appearance or wrinkled paper appearance. Okay, so this is crumpled tissue paper or wrinkled paper appearance, and this is characteristic feature in the Gaucher's disease. So once again we will revise. Gaucher's disease is a autosomal recessive lysosomal storage disorder due to mutation in the hydrolases. The enzyme which is deficient in the Gaucher's disease is beta glucosidase or beta glucocerebroside, due to which there is accumulation of glucocerebrosides, and due to which the lysosomes, they are engorged, or they are laden with the lipid molecules or glucocerebroside that gives typical wrinkled paper or crumpled tissue paper appearance. Okay, and it involves the liver, spleen, and bone marrow. Liver, spleen, it involves liver and spleen, it causes hepatosplenomegaly. It causes pancytopenia, which includes anemia, and thrombocytopenia. Thrombocytopenia is due to sequestration of platelet in the spleen that causes easy bruising. In the bone involvement, there is avascular necrosis of the bone due to decreased blood supply to the bone, also decreased bone mineral density that causes osteoporosis. So there is typical deformity in the long bone that is known as Erlenmeyer flask deformity. Erlenmeyer flask deformity of the long bone. Okay, and in Gaucher's disease, typically in type 1, there is no neurological involvement. Keep this point in mind. There is no neurological involvement in the Gaucher's. Also, there is no cherry red spot on the macula in the Gaucher's disease. Okay, these are the important points related with the Gaucher's disease. Now see the second, we will discuss the second important lysosomal storage disorder. See, a child presented with difficulty in vision. On examination, cherry red spot. See, cherry red spot on macula. There was no organomegaly. This is characteristic feature, no organomegaly. Organs are not involved. Okay, and identify this disease. If organs are not involved, okay, presented with difficulty in vision on examination, cherry red spot. Remember, in lysosomal storage disorder, there is cherry red spot on the macula on eye examination. Okay, but there are three diseases in which there is no cherry red spot, that is KGF, Krabbe's disease, Gaucher's disease, and Fabry's disease. Krabbe's, Gaucher's, and Fabry's disease. Okay, so difficulty in vision on examination, cherry red spot on the macula. Now see, this is excluded. Okay, Hunter disease, there is corneal clouding. Okay, there is corneal clouding, and also in Hunter's disease, there is no corneal clouding in the Hunter's disease. Hurler's disease, there is corneal clouding, but regarding cherry reds, there is no cherry red spot on the macula in the Hunter's disease. This is mucopolysaccharidosis, MPS. Okay, point to remember, in the Hunter's disease, it is a X-linked disorder, typically affect the male. It affects the male, and there is no corneal clouding, no corneal क्लाउडिंग, क्योंकि ये हंटर है, इसका विजन नॉर्मल होना, इसके पास एक्स रहती है उसको शिकार करने के लिए, तो इट इज एक्स लिंक डिसऑर्डर and there is no corneal clouding. Vision is clear, means cornea is clear in the Hunter disease due to defect in the enzyme iduronate sulfatase. Okay. So this is Niemann-Pick disease. There is cherry red spot on the macula, but there is hepatosplenomegaly in the Niemann-Pick disease. This is due to defect in the enzyme sphingomyelinase. Okay, and now the left one is Tay-Sachs disease. See, Tay-Sachs disease. T for 2. It is GM2 gangliosidosis. Tay-Sachs disease, it is GM2 gangliosidosis, Tay-Sachs disease and Sandoff disease. Tay-Sachs disease, there is defect in the enzyme hexosaminidase A. There is defect in the enzyme hexosaminidase A. Okay, hexosaminidase A. Tay-Sachs disease. The typical feature is there is no organ involvement in the Tay-Sachs disease, but there is cherry red spot on the macula. Tay-Sachs disease. It is there is progressive neurological involvement in the Tay-Sachs disease. Progressive neurological involvement, and there is eye problem. While in Sandoff disease, which is also a GM2 gangliosidosis, there is organomegaly. Additional feature is organomegaly in the Sandoff's disease. Okay, so see this chart. मैंने पहले ही बोला था पूरा का पूरा चार्ट याद रखने की कोई जरूरत नहीं है, लेकिन कुछ इंपॉर्टेंट चीजें हैं जो फ्रिक्वेंटली पूछी जा रही है, जैसे गाउशर्स डिसीज, Tay-Sachs disease and the Niemann-Pick disease. These are the important to remember. Then cherry red spot किसमें नहीं रहता है, न्यूरोलॉजिकल इन्वॉल्वमेंट किसमें नहीं रहता है, जैसे गाउशर्स डिसीज एंड फैब्रीज डिसीज, देयर इज नो न्यूरोलॉजिकल इन्वॉल्वमेंट. ओके, गाउशर्स डिसीज, okay, there is involvement of liver, spleen and bone marrow, defect in the enzyme beta glucosidase or glucocerebrosidase, beta glucosidase or glucocerebrosidase, and accumulated compound is glucocerebroside. Okay, Niemann-Pick disease, this is due to defect in the sphingomyelinase, and accumulated product is sphingomyelin. It is sphingomyelin. Krabbe's disease, the beta galactosidase is defective. There is accumulation of galactosyls or galactocerebroside or galactosylceramide. Okay, then Fabry's disease, point to remember in Fabry's disease, it is X-linked. All are autosomal recessive. Fabry's, it is X-linked disease. It is and in Fabry's disease there is angiokeratomas. The telangiectatic skin lesions, they are known as angiokeratomas. It is a feature of Fabry's disease and GM1 gangliosidosis. Angiokeratomas, it is feature of Fabry's disease and GM1 gangliosidosis. So Fabry's disease, it is X-linked. It is due to defect in the alpha galactosidase. Okay, then Tay-Sachs disease, this is again important. Tay-Sachs disease 2, GM2 gangliosidosis with no organ involvement. The typical feature is progressive neurological involvement, and second is eye involvement is there. So liver and spleen particularly not involved in the Tay-Sachs disease due to hexosaminidase A defect. It is also the accumulated product is GM2 gangliosidosis. Then Sandoff disease, additional feature along with the Tay-Sachs disease. Tay-Sachs में हमने क्या बोला था, eye involvement, brain involvement और central nervous system involvement. Sandoff में additional organomegaly is there in the Sandoff disease. It is because of hexosaminidase A and B defect. Then metachromatic leukodystrophy, it is due to sulfatase defect, and Farber's disease, it is due to ceramidase defect. The accumulated product is ceramide. So just wait, we'll revise the important points. The first important is Gaucher's disease is a most important lysosomal storage disorder. Okay, all are autosomal recessive except Fabry's disease, which is X-linked disorder. We'll keep this except Fabry's disease, which is a X-linked disorder. Okay, in lysosomal storage disorder, there is cherry red spot on the macula, uh, but there is no cherry red spot in KGF, Krabbe's, Gaucher's, and Fabry's disease. Okay, there is no organomegaly in Tay-Sachs disease, but the GM2 gangliosidosis, another GM2 gangliosidosis, that is Sandoff disease, there is along with the eye and brain involvement, there is hepatosplenomegaly. The Niemann-Pick disease, it is due to sphingomyelinase defect. This is also important question for first year student. Sphingomyelinase, Niemann-Pick disease, it is due to हर स्पिंगोमाइलिनेस डिफेक्ट. हर अल्टरनेट एग्जाम में यूजी में ये क्वेश्चन रहता है. निमैन-पिक डिसीज इज ड्यू टू स्पिंगोमाइलिनेस डिफेक्ट. ओके, इट इज ए स्पिंगोलिपिड, है ना. फॉस्फोलिपिड, स्पिंगोलिपिड कैसे रहता है? ग्लिसरोफॉस्फोलिपिड, स्पिंगोफॉस्फोलिपिड, है ना. ग्लिसरोफॉस्फोलिपिड में ग्लिसरॉल अल्कोहल रहेगा, स्पिंगोफॉस्फोलिपिड में स्पिंगोसिन अल्कोहल रहता है, जो कि अमाइनो 18 कार्बन अमाइनो अल्कोहल है. ठीक है, ग्लिसरोफॉस्फोलिपिड, स्पिंगोफॉस्फोलिपिड, स्पिंगोमाइलिन इज द स्पिंगोफॉस्फोलिपिड. ठीक है, मैंने यूजी के लिए यहाँ पे दो इंपॉर्टेंट क्वेश्चन बताए. पहला एक बताया व्हाट इज सेरामाइड, इट इज फैटी एसिड प्लस स्पिंगोसिन, दैट इज सेरामाइड. दूसरा कौन सा बताया कि स्पिंगोमाइलिनेस डिफेक्ट कॉजेस निमैन-पिक डिसीज. ये दोनों क्वेश्चन यूजी के लिए इंपॉर्टेंट है. लेकिन अभी बीएक्यू और केसेस, क्लिनिकल केसेस जैसे ही सीबीएमए में इंक्लूड किए गए हैं, तो ये सब इंपॉर्टेंट हो गए. पर्टिकुलरली द गाउशर्स डिसीज, इट इज पर्टिकुलरली इट इज इंपॉर्टेंट फॉर यूजी एंड इट इज वेरी वेरी इंपॉर्टेंट फॉर द नीट पीजी प्रिपरेशन. गाउशर्स डिसीज, each and every point regarding the Gaucher's disease is important. Okay, so these are the important points to remember in the lysosomal storage disorder. So keep watching. Thank you.